Assalamu alaikum to everyone. So we are starting the next topic, that is the chiral separations or the importance of the chiral separations. So chiral chromatography is not something that is only related to the thin layer chromatography. Chiral separations can be done by either the HPLC, high performance liquid chromatography, or they can be done by using the gas chromatography techniques. So we can also separate the chiral molecules by using the thin layer chromatography. So there are different ways by which we can use the different techniques to ensure that we are separating the two enantiomeric forms of the same compound, that is R and S isomer, can be separated out. Now, why we are so focused about the chiral separation is because the living system, for example, is composed of the biomolecules such as amino acids, sugars, proteins, and nucleic acids are there. And in these, the biomolecules exist only in one of the two enantiomeric forms. For example, आपके पास जो amino acids हैं, they are in L form and the sugars are in D form. So it is imperative for us that we should find out whether we are giving a body an R isomer or an S isomer, because they will behave differently when they enter into the body. The reason being, the body being amazingly chiral selective will interact with the racemic drug differently and metabolize each enantiomer by separate pathway to produce the different pharmacological activity. So that is what I am saying, that आपके body में जो है these isomers, enantiomer isomers, they will not behave differently unless and until they are exposed to the chiral environment. That is, since they have the same physical properties, they have the same chemical properties, they have almost all the properties that are same. Only thing is that they differentiate. When they differentiate is they when they put them into the chiral environment, that when we are exposing the chiral molecules, that is R and S isomer of a same molecule, to the chiral environment, they will behave differently. One of the isomer may be active, other isomer may be inactive, or it may be having the adverse effects. For example, you have the simple example here, that is called as the drug thalidomide, that was called as a wonder drug. It was exclusively used for the treatment of the morning sickness, that is nausea, for the expecting ladies, and it was given to them for the uh, for the treatment of nausea. But it was later on found that it was only the R isomer of this thalidomide drug that was uh, having the therapeutic activity, while as the S isomer, which was not found at that point of the time, after many years, it was found that it has a tetragonic effect, result in the formation of deformed skulls, deformed bones, and having the very adverse effects. So it is very important that we need to have a separation technique which separates the two enantiomers, so that we can have the different enantiomers and we can find out the activity of the each enantiomer in a drug molecule. Now, chiral separations can be done. Now, why we need to separate the chiral isomers? That the two enantiomers of any chiral compound exhibit the same physiochemical properties that I already told you. So they can be distinguished, they're separated by different interaction with the chiral molecules, generally the different behavior in the chiral environment. That is, I already explained that since they have the same chemical properties, they have the same physical properties, that is same molecular weight, same shape, same structure, same melting point, same boiling point, density, solubility, polarity, Ri, energy, and say almost everything is same. That is, we cannot use any of these parameters to separate these two isomers. For example, you have L amino acid and D amino acid. You cannot separate these amino acids by using of any of these parameters. That is, you cannot use the boiling point, you cannot use the density, you cannot use the polarity, you cannot use the refractive index. No other technique can be used for the separation of these isomers. Only thing what can be done is that when these two amino acids, that is L amino acid and D amino acids, are put into the chiral environment, they will behave differently. Unless and until you are not putting the R and S isomer in a chiral environment, will not behave differently. They will be having the same properties uh, in terms of their all others, in terms of their melting points, their chemical reactivity, their polarity. So they differ only when you are exposing when you are exposing them to the chiral environment. So it becomes interestingly important to distinguish between two enantiomers for optical activity active compound. Now, in many drugs, as I told you, one of the optical isomer is pharmacologically active, and the other may not be pharmacologically inactive, or it may have adverse effects. So it is very important that we need to have a system in place that result helps us to separate these compounds. Now, enantiomers can't be separated as they show same physical and same chemical properties towards the a chiral reagent. A chiral reagent, I'm saying the chiral reagent, that is when you are using the chiral reagent, they show the same physical properties, they show the same chemical properties, so we can't separate them. They can't be separated on the normal chromatographic method as both isomers have the same attraction towards the stationary phase. So if we are using the achiral adsorbent phase, then for example you are using a simple silica gel, then it will not behave differently because they will show the same interaction. The both isomers will show the same interaction with that of the adsorbent, and they will not be separated out or the resolved. But if you are using the chiral adsorbent, if you are replacing this stationary phase by a chiral adsorbent, then only you can separate these L and N D amino acids by using the chiral adsorbent. So we have to find out how we can separate these isomers so that we can differentiate between R and S isomer and find the pharmacological activity of the two compounds, which may be that one of the isomer may be active and other isomer may be either active or it may have an adverse effects. So this is why we are separating these. We are focusing about the chiral separation is that ibuprofen has a two isomers. S isomer is an anti-inflammatory, and R isomer of the same drug molecule is having the less efficacy as that of an S isomer. Naproxen is another drug in which R isomer is used for the arthritis pain, while its S isomer is a tetragonic, that is, it results in the deformation in the bones. Thalidomide, as I have told you, was used earlier in 1960s for the treatment of nausea, morning sickness. However, it was later found that the S isomer of the same drug was having the tetragonic effect, which results in the birth defects. Stelopram is another drug that is an antidepressant drug. Its S isomer is antidepressant, having the pharmacological activity, but its R isomer is inactive. Now, it is very important that even if the R isomer is inactive, like in this case, or R isomer is less effective, as in this case, though they have not the adverse effects, still they need to be separated out because your body needs an extra effort to metabolize these drug molecules that are not required by the body. जबकि आपके पास इब्रोफिन मॉलिक्यूल है, इसका एस आइसोमर जो है एंटी इंफ्लेमेटरी काम करता है, बट इट्स आर आइसोमर इज नॉट is less effective. So your body, if you are administrating the R and S isomer of this ibuprofen, then S isomer will do its work, but R isomer जो है, the body will need an extra work to do to metabolize this system. That is R isomer को metabolize करने के लिए उसको extra effort लगेगा. So again, this is not advisable. So most of the drug companies now are synthesizing the drugs in the enantiomeric pure forms so that they are sure that the one isomer is only having one isomer is only administered to the body so that it will not have the adverse effects to the system. Now, how these drug molecules behave differently? So we are focused because when we place the drug in chiral environment like human body, because it can differentiate the chiral molecules, animals and plants, they can differentiate them. So you have a plant pesticides which can have the chiral, uh, uh, which can have the racemic mixture. You can put the chiral drugs in animals, then they will behave differently when we put R and S mixture in the HPLC chiral stationary phase. So how we can differentiate these drug molecule is simply that we can use the chiral stationary phase to separate these compounds. The pharmacological activity of optical isomer of a racemic drug differs in the human body since the body itself is chiral. That is what I am saying earlier कि आपका body system जो है it behaves differently for the different drug molecules. It behaves differently for R isomer and it behaves differently for S isomer. So it is very important to separate these drug molecules into the R and S form before they are putting into the body. One of the optical isomer may be beneficial and other may be harmful, even deadly. That is the case of thalidomide drug, while in one of the isomer was used for the treatment of nausea, nausea for the treatment of the it was used for the treatment of sorry morning sickness, and other was having the tetragonic effect on the body system, resulting in the formation of deformation of the bones of the body. However, the purification systems for the production of the single enantiomer drugs can be challenging and expensive. So this is a very important part because when you want to separate the enantiomers in a pure form, that is R and S isomers separately, then you need to have a system in place where you need to have a chiral adsorbents or you need to have a chiral solvents which can separate these enantiomers, and it becomes very expensive and it is not, they cannot be separated on the conventional chromatographic technique. So you have an enantiomer, you have a chiral molecule, and it has a non-superimposable image. Similarly, a chiral molecule and its superimposable mirror image. So you have a chiral molecule which have a superimposable image, and you have a chiral molecule which have a non-superimposable image. So these are the enantiomers, these are the identical molecules. So these enantiomers are of importance because they will behave differently when you place them in a chiral environment. So for example, you have a R-limonene and you have a S-limonene, they have the different properties. So in a body system, when you place such a chiral system in a body, they will behave differently in a body. Enantiomic separation can be done by, now we will move to the enantiomic separation. It can be done using a chiral adsorbent. हमारे पास कोई chiral adsorbent होगा उस पे separate कर सकते हैं, or we can use the chiral additives in a solvent. We can add certain additives in a solvent which can help in separation.